You know, when we think about pressure injuries, it's easy to just see them as, well, wounds. But what if there's something much, much bigger? What if they're actually a direct mirror of the quality of care happening in a hospital? Today, we're going to dig into why these injuries are one of the most powerful signals in all of healthcare. And look, the source material just puts it perfectly. Pressure injuries are considered sentinel indicators. So what does that mean? It means they aren't just isolated problems for one patient. No, they're like a giant flashing red light, a major signal that something in the whole system needs attention. Basically, the health of a patient's skin can tell you an awful lot about the health of the entire healthcare facility. So, what's that flashing red light signaling? It's pointing to some really fundamental gaps in how care is being delivered. And we're not talking about bad luck here. We're talking about system failures, failures that are preventable. And understanding those failures, that's absolutely crucial if we want to improve patient safety.
Okay, so to really wrap our heads around this, we've got to understand the full picture. Let's start by establishing exactly why this is so much more than just a wound.
Now, what's really important here is how specific this clinical definition is. It's localized damage, usually over a bony prominence. And it's caused by two main forces: sustained pressure, which is pretty self-explanatory, and pressure combined with shear, which is like a pulling or sliding force. So this isn't just any old skin problem. It's a very specific type of mechanical injury.
So, how does this damage actually happen? Well, it's not instant. It's more like a domino effect, a cascade of events that breaks the skin down, really from the inside out. Let's walk through how that process unfolds.
It's this four-step cascade. First, you have that sustained pressure, right? And that just cuts off the blood flow. That leads to step 2, compromised perfusion, where the cells are literally being starved of oxygen and all the good stuff they need. Next, you get cellular ischemia. You know that feeling when your foot falls asleep? It's kind of like that, but in this case, the tissue doesn't wake up. And that leads to the final step, irreversible tissue necrosis and breakdown. The cells die and the tissue follows. And this image, wow, it just shows you exactly what's going on under the hood. You can see how the damage goes way beyond the surface. It can extend from that outer layer of skin, the epidermis, all the way down deep into the fat and muscle. It's a progressive destruction, layer by layer. All right, so we know what it is, and we know how it happens. So the big question is, how do we get out in front of it? Well, the key is all about gauging the danger before the damage even starts.
And the risks really fall into two main buckets, as you can see here. On one side, you've got the extrinsic factors. These are the outside forces acting on the body. Things like pressure, friction, even the moisture level on the skin. On the other side, you have the intrinsic factors. These are all about the patient's own vulnerabilities. Stuff like being unable to move, poor nutrition, or advanced age. It's when you get a combination of these two that you have the perfect storm for skin breakdown.
And that storm tends to hit some very specific spots. We're talking about the bony parts of the body where there's just not a lot of natural padding to protect the tissue. Think about the back of the head, the shoulder blades, the tailbone, the hips, and especially the heels. Any place where a bone is close to the skin is a potential hotspot. So how in the world do clinicians keep track of all these risks? Well, they use a standardized tool called the Braden scale, and it's way more than just a checklist. It's a systematic way to really tell the story of a patient's vulnerability, and then use that story to build a targeted prevention plan. And interpreting that story is actually pretty straightforward. But here's the one thing you have to remember. It's backwards from what you'd think. A lower score means higher risk. So if a patient scores below a 9, they are at very high risk, and we need to throw every preventative action we have at them. Meanwhile, a score of 23 means they're pretty safe. That single number is incredibly powerful. It literally dictates the entire plan of care to keep that patient's skin safe. But what happens when prevention doesn't work, or maybe a risk gets missed? Well, that's when an injury can escalate, and fast. It can go from just a little red flag to a full-blown crisis in no time. And it all starts right here with a careful, hands-on assessment. Clinicians are trained to look and feel for the absolute earliest, most subtle signs of damage. Why? Because catching it early is, well, it's everything. And that first sign brings us to the most critical stage of all. This is stage I. Now, it might just look like a red spot on the skin that doesn't go away, but this right here, This is the critical window. This is the only stage that is potentially reversible. It's your one chance to turn things around. If you miss this, you're heading down a path toward irreversible tissue damage. And that path leads here. In a stage 3 injury, you're seeing full thickness skin loss. You can actually see the fatty tissue underneath. But by stage 4, the damage is frankly catastrophic. You have full thickness skin and tissue loss, with muscle, tendon, or even bone exposed. The difference between these two is stark, and the consequences for the patient are just devastating. Okay, now here's a really important clinical distinction. It's being able to tell a pressure injury apart from moisture damage. As you can see, a pressure injury happens over a bony pressure point and usually has pretty clear, distinct borders. Moisture damage, on the other hand, is more superficial, kind of widespread with irregular borders. Getting this diagnosis right is absolutely critical because the treatments are completely different. So, we've talked about all these risks and these scary stages. How do we fight back? The good news is, this is not an unsolvable problem. There's a really clear, evidence-based game plan. So let's open up the prevention playbook. Think of it like a multi-layered defense system. The core strategies are things like regular scheduled repositioning, using special mattresses and support surfaces, doing daily skin checks from head to toe, controlling moisture, making sure nutrition is optimized, and carefully managing any medical devices. The key is, it's not just one of these things, it's all of them working together to create a shield of protection for the patient. And that brings us to the final and maybe the most important part of the playbook, accountability. Because you can have the best plan in the world, but it's useless if it's not put into action. This is an active, ongoing, professional responsibility. For the nursing team, this all boils down to a continuous cycle of 5 key actions. Assessing risk on time, every time. Identifying any potential injury at the first possible sign, starting those preventive actions immediately, documenting everything you do, and escalating concerns when something isn't working. It's a loop that never stops. And why is that documentation piece so incredibly vital? Well, this quote from the accreditation standard says it all. Care that is not documented is considered care that was not provided. It's the golden rule in healthcare. If you